Then all the settings, Mr. Machine.
ravaged a lot that ravaged a lot of countries in West Africa. It was clear during Ebola, the 2014 to 2016 Ebola, that West African countries lacked the capacity to cope with such level of health threats. And there was an urgent need to set up organizations, both governments and non-governmental organizations, to build capacity of government and non-governmental organizations to cope with such level of health threats. And Global Emerging Pathogens Treatment Consortium, GET, was one of the organizations that was set up, one of the non-governmental organizations that was set up, with the aim of working with both governments and non-governmental organizations to build their capacity to cope with emerging biosecurity threats. And since 2014, we've been working with both government and non-governmental organizations using different platforms to build capacity on the continent of Africa. And one of the platforms we've been using in recent years, in the last 4 years, is the monthly GET webinar series that brings together experts from different parts of the world to discuss emerging issues in the area of health security and biosecurity. And today we'll be focusing on a very, very important topic, which is strengthening health financing in Africa in the wake of dwindling international support. We are going to be talking about money. Where exactly is the money? How can Africa develop innovative and strategic approach to funding health systems in Africa? You agree with me that in recent years, we've seen significant reduction in health financing in Africa due to donor fatigue, shifting global priorities, changes in political ideology, and economic challenges to developed countries in the world. It got to a peak last month when the president of America suddenly pulled out the USA from the WHO and also reduced or paused the activities of USAID for some months. This action will have significant impact on Africa and especially the health sector in Africa. US contributed about $1.2 billion to WHO in 2023, and that accounts for about 15% of the total budget of the organization. And Africa receives about $8 billion from USAID to fund different projects in the year 2023. So withdrawing this huge amounts of funds, we have significant impacts on the health sector in Africa. About almost 50% of countries in Africa still depend on international funding to support their health systems. In fact, budgets of almost 40% of Africans, about 50% of their budgets still comes from international funding. So with the dwindling international support, we are going to have significant impacts on the health sector in Africa. And it has become very important for us to look inward, to look for innovative strategic approach to fund health system in Africa. And for African countries, not just governments, but also non-governmental organizations, to look inward and look for ways to fund health system within the continent. And that is why we are focusing on this very important issue today, strengthening health financing in Africa. Where exactly is the money? How can we generate money or finance within the continent to support health system and meet our health finance demand? Basically, today we'll be considering accessing the impact of reduced international health support on African health systems and identifying the gaps. We are going to showcase successful models and innovative approach for mobilizing domestic resources and public-private partnership. We'll discuss how government strategies and policy reforms is needed to enhance transparency and efficiency in health financing, and how we can foster multi-sectoral collaboration to ensure sustainable health financing in Africa. And to discuss this very important topic today, we have top subject matter experts that will be speaking with us. We have 3 top subject matter experts today, and I'm going to be introducing them one by one. Before we go to our subject matter experts, let me just lay down the rules of today's webinar. Each of our experts will be speaking for about 25 to 30 minutes. And after that, we are going to be having question and answer section for about 15 minutes. In between their presentations, I'm going to be introducing some of our activities and what we're doing in GETS. So without wasting much time, I'm going to be introducing our first speaker today. Our first speaker is Dr. Tosin Dotun Olujimi. She's a senior healthcare consultant, ID at Public Health Consulting International in Canada. I'm going to read about for about 2 minutes and hand over the floor for her to give her contribution. Dr. Tosin Olujimi is a public health specialist with over 20 years of experience in public health administration and research methodology for evidence to support programs and guide policy development. A married experience in public health was acquired from Nigeria, the United States of America, the United Kingdom, Canada, and she's very equipped with a robust international health experience. Dr. Tosin serves as a senior consultant for ID Public Health Consulting International in Canada, and she's involved in academia and community services while writing chapters in books and collaborating on pertinent research topics. She has presented her knowledge on several platforms, including the World Congress on Public Health, held in Rome, Italy, and the 14th European Public Health Conference, as well as a keynote speaker at many international events. Dr. Tosin is a member of the American Healthcare Executives, the Canadian Public Health Association, and the Ontario Public Health Association. Dr. Tosin, thank you for joining us today. Please, you have the floor for about 20 minutes.
Thank you, Dr. Dotun. It's a pleasure to be here this morning. I don't know if I have my slides being shared.
Okay,
You can do that, or you want me to share it from my end?
You can share it from your end if you want.
Okay, you can go ahead and share, then we move, that might facilitate that.
So Secretariat, please share Dr. Tosin's slides as soon as possible.
Thank you, everyone. Thank you for inviting me to this important webinar. Just a few hours ago, there was a court, not only in Africa, but also here. There's so much conversation regarding cuts in foreign aid. And on Al Jazeera this, few hours ago, I did see that the court ordered the president to release foreign aid. So to an extent, it's good news, but I think there are a few things we have to look at. While that is reinstated, what are the lessons we've learned on the continent? This morning, I'm speaking on evaluating the impact of reduced international health support on Africa's healthcare system. And as we all know, the next slide, please. So there had been an increasing gap. The next slide, please. There had been an increasing gap to Africa's foreign aid, probably because there hadn't been much attention paid to that because I guess maybe those donors were not that significant on the continent. We knew that Germany, France, Norway, they all reduced their funds to Africa in the last 5 years. And recently, in 2020, the UK government also reduced their overseas funds, from the 0.7% to about 0.5%. And living on this side of the world, there's so much that happened, during COVID and post-COVID. During COVID, there was so much this disbursement of funds, just to build global capacity and solidarity to tackle the COVID virus, where a lot of countries are facing economic turmoil as well. So there's a cutback in so many things. I can attest to that also within the Canadian health system. There's so many services that are no longer made available at your physician, at your doctor's office as it used to. So there's a cutback internally as well. And I would assume that, certain priorities for external funds had to be rolled in on national basis. But the recent one that has sent the whole world in turmoil, maybe the continent, is the US fund that had been withdrew from Africa, let's say a pause by the new government, by the new president, Donald Trump. And we see that because about 60% of the healthcare sector are funded by the US aid. And that is why there's so much effect of it on the continent. Next slide, please. So what are the key impacts? Where are we seeing this? I'm sure, US also looks into the governance on the continent, but probably because healthcare, which we're talking about, is very visible, and that's, some key aspect of the impact is being shown in program, is being seen in terms of initiative that has stalled. The first key impact I'm going to talk about with the withdrawal of foreign aid is reduced access to vital treatments. Many African countries have depended on international aid to fund critical health initiatives, HIV, AIDS treatments, malaria, as well as maternal health and childhood health programs, vaccination campaigns. They have been funded primarily or extensively through US aid. And we all know about the PEPFAR that has significantly improved the HIV treatment on the continent. With this being frozen, with the US aid being frozen, we can see that there had been disruption of services on the continent. And this has increased to new HIV cases that are emerging that had not been released under the waiver to have funds channeled towards that area. So we are seeing increase in HIV-related new cases that are pending because of the stalled in funding. Next slide, please. So this puts many at health risk. So that's an important one. The next slide, please. So also looking at funding, we look at malaria, which, it's a health issue on the continent. We see that the funding shortages remain prior to this announcement in January. There had been a shortfall since 2023 regarding funds channeled towards malaria prevention. There had been a shortfall of 8.3 billion in 2023, and this gap has grown from 2.9 billion in 2019 to about 4.3 billion in 2023. When I saw this number, the first thing that came to mind is it due to the rising cost of delivering healthcare, but also, we all also know that it's primarily due to this cutback in international aid, to other from donors to the continent. So we see that following the US government's 90-day freeze on foreign aid, there's uncertainty over more contribution through the Global Fund, which provides 62%. Look at that amount of international fund, 62%. That is more than half of the required fund to provide this malaria program on the continent. That means, what does this translate to? That Africa's fight against the disease is facing a great financial shortfalls, and it will make delivery of malaria intervention more challenging, especially with the rising cost of antimicrobial resistance, climate change. this is going to really impact this program on the continent. Next slide, please. And we look at maternal and child health programs that has been impacted by this US aid pullback. Also in vaccination, we know that the preventable diseases like measles and polio are primarily funded by US aid. What about the nutrition programs that addresses child development, also impacted by a cutback in this US aid? Another key impact area, and I know that it's important to get, it's disease control and outbreak response. This is a key area that will be greatly impacted, if not already. And we see that cutting fund here would prevent the ability of African nations to effectively respond to infectious diseases, where we are still handling, community outbreaks and assuring some capabilities at the community level. How can a cutback without support on new and emerging outbreaks, how can they be prevented or addressed with the required capacity with the cutback? So we see here that in responding to Mpox outbreak, the WHO and the Africa CDC, they coordinate efforts, and the projected funding goes into billions, and out of this, US alone contributes more than half, or about half of the contribution. So with the pullback of the US from the WHO, which is under review, it's going to translate into substantial consequences on the continent with the help that the continent gets from these two major organizations in events of outbreaks. Global health security is another area that will be greatly impacted. And we see here that it will be compromised. How? Cutting funds cuts will weaken African system because there won't be enough. I think I'm on the 8th slide, please. I'm speaking. So funding cuts back will weaken African system and increase the risk of epidemics and pandemics. We see that going on even internally in DCR or DRC. And reduced support for disease surveillance and response system would hinder the ability to quickly identify and contain outbreaks, posing a threat not only to Africa, but to global health. International health cuts will also impact research and development because as it stands now, it's not a priority to the US government, obviously, on the continent. And this effort indeed aim at understanding and combating emerging infectious diseases, and this further compromises global health security. What other impact do we see when the health system on the health system with a cutback? We see a disruption of health system infrastructure. The WHO director mentioned in his opening speak at the 156 section that there had, despite the waiver to continue to provide services through PETPAR to HIV/AIDS services, it claims that the clinics providing such services are still closed. And we do also know that through the foreign aids, capacity building and is provided to Africa in regards to hospitals, building, clinics, and laboratory. So withdrawal of such funds would definitely impact the development and maintenance of these vital facilities where health services are provided. Another challenge we would see, if not already, will be an impact on human resource. There are so many health workers that are funded through most of these programs. Many NGOs are funded by USAID and other international funding. A pullback, there will be a significant decline or I won't say, yeah, a decline, and also a disruption in training that supports capacity building for healthcare workers in Africa. And it also exacerbates the existing shortage of skilled medical professionals that that are exiting the continent. With US aid being closed, I think there are so many of the foreign workers that has also been called back that are instrumental to services on the continent. I reading this report on yesterday from US aid that in South Africa alone, due to this US government freeze of foreign assistance, roughly about 50,000 PEPFAR funded HIV response staff across that nation alone and 27 priority districts have been affected. And this translates into over 250 millions of US dollars, and this put about 222 people living with HIV just in South Africa alone, including children of over 7,000, you know, in despair. Another area key impact of this reduction, it would lead to an increase in vulnerability and health inequalities. Areas that are already compromised, population that are marginalized would further experience, health challenges in DRC alone. Even despite the conflict that had been ongoing, majority of the NGO that are being funded by US aid provide services to that area. So in addition to facing conflict, there is also a suspension of healthcare services in that region. And this also includes pregnant women are also unable to reach health facilities that are far away from them because the facilities close to them had been shut due to to a pullback in the US aid funds that support the NGO that provide services in their domain. Now, also, I would say those are like the negative implication. But in everything, we also have to look at the opportunities. What's the impact on the continent regarding, what we are experiencing with a cutback? There's so many literatures out there, so many writings, and many of the experts are speaking about the opportunities or the ability to rethink health financing on the continent based on the recent US aid fund pullback. The Africa CDC director mentioned, I think on BBC last week, that we begin to see these challenges as an opportunity. One area is for us to help begin to rethink health financing. And for me, looking at this, there's an increase. There should be an increase in domestic funding, and it's already happening. That many African countries should or has begun to make attempt to mitigate the impact of reduced international funding, meaning they're not so dependent on international funds as much. I think last few weeks ago at the African Union meeting, there's a declaration by the First Lady of Nigeria about Nigeria embracing the 2001 Abuja Declaration, which states that there should be up to 15% of the GDP allocated to health care financing. So it's good that to see that Africa is taking autonomy of their own health, and also diversifying domestic resource mobilization, looking at possible way of looking out for funds on the continent other than just from the GDP. Another great way would be through taxation. And Zimbabwe had exemplified that success. with tobacco taxation. The recent one that occurred even before the announcement in January, with a pullback from the US, and I guess probably due to the observation of the withdrawal of international fund, was done November of 2024 with a new levy on sugar. So we see that Zimbabwe is taking stride. Another way, quite impressive, is Nigeria absorbing healthcare workers that were formerly paid by the US aid. And I think it shows that Africa can indeed, you know, demonstrate domestic health financing in Africa as a possibility. Regional cooperation and collaboration, that is one remarkable thing I have seen through this process. Dialogue between countries, cooperation and declaration of channeling funds towards the HIV/AIDS programs that have been affected by PEDPA, and also the malaria prevention programs, the continuity of it, and providing additional funds as nations towards that, and also donor diversification. And I like the fact that we see Africa being proactive. Recently the Director General of the CDC Africa met with the Prime Minister for Singapore to learn some strategy, to collaborate on some strategies on things that had worked within the Singapore health system and that can be translated on the continent. So we see Africa going beyond the Western countries to other nations, i.e. the Singapore collaboration or the meeting that occurred a few weeks ago. And also Rwanda had partnered with China in building some hospitals, some healthcare facilities in their nation. So we see that there's a need to step out of the norm that Africa had been used to, and to explore other terrains for developing or for establishing relationship that will promote Africans' well-being. In conclusion, I would say that the withdrawal of this international aid definitely would lead to reduced access to health services, and it has already, but there have been proactive measures to sustain, the fundamental programs, and indeed increase disease burden if nothing is done. And potential instability in public health systems will be seen across the continent without a filling of the gap. And much more, global health security will be compromised. But likewise, it gives Africa the opportunity and the ability to take autonomy of their health outside of the impact of the US, especially, who is the major donor to the continent, making it making it sustainable and independent of this dependency. So in conclusion, I would say that even with few of these things reinstated, like the funds, I believe that Africa should move forward in ensuring autonomy of their own health. I would like to share, I've been to continents and I've had a chance to study health system across the world. But one of the things I see is that if every country makes whatever aspect of their infrastructure a priority, it's high time that Africa has to make health a priority and know that health translates into economic empowerment. And I would like to say that Africa is a wealthy continent that can, that can develop domestic funding for their own health. Just to mention, I have studied and have been to a small island, which is Cuba, And it's amazing, how they have funded their own health system with their domestically without external donors. And if you do research Cuba, they have one of the best health systems in the world. So Africa can do this. We have the resources. And I am really glad with the proactive measures that had emerged. And I believe this should be ongoing. And for us to see a change on the continent, it will mean Africa rethinking, their health financing in a different way that they have been used to. Thank you.
Thank you very much, Dr. Tosi. That presentation was very informative. And personally, I learned so much from your presentation. You gave a very detailed presentation on the impact of reduced funding. We started by stating clearly that it's not just the United States of America that have reduced funding, but over the years, issues like challenges, economic challenges with developing countries like UK and few other European countries have made them reduced funding, especially to Africa. For example, UK reduced their funding from 0.7 of GDP, from 0.7 of GDP to 0.5 some years ago. But the climax was the US this year that stopped funding or stopped the USA funding, or paused it, not stopped, paused USA funding and withdrew from WHO. And that will have a significant impact on the economy of African countries, and most especially the health sector. And you talked about the impacts in different areas, impacts in HIV, maternal and child care programs, nutrition programs, humanitarian programs, and especially in infection prevention and control, impacts on areas like addressing epidemics and pandemics. Pandemics, an outbreak anywhere in the world today, if you don't address it as early as possible and build the right surveillance, might become a global issue within a very short period of time. And that is why things that have to do with health security, pandemic and epidemic surveillance, they are now global issues. They are not national issues. And if you don't take it very serious, a problem in one small village in Africa can become a global problem within a very short period of time. So there is need for global solidarity in areas like that, with capacity building, with disease surveillance. And you said this is not just affecting government organizations. A whole lot of NGOs are affected by these funding challenges, especially in Africa. A whole lot of NGOs depend on, and almost all NGOs actually depend on support, both local and international support for their activities. And you can't you can't talk about the importance of NGO or what NGOs are doing on the continent. They play a very significant role in ensuring that government is doing the right thing and supporting communities in Africa. So there are serious impacts of donor funding challenges on the continent of Africa. And we're already seeing the impact in different areas, in malaria research, in HIV/AIDS, in tuberculosis, and other areas. And like you said, it's important that Africa turn the challenge to an opportunity. Look for innovative and very strategic ways of addressing this challenge. And this is maybe if we're able to overcome this may become a very big breakthrough for Africa, and it can make us more serious and handle our challenges and find innovative ways of solving our problems. And we talk about things we can do: increase domestic funding. Africa is not a poor continent. We just need to manage our resources effectively. I think it is time for African leaders to look inwards and see how we can be very efficient in handling our resources. Diversified domestic resources, public-private partnership is very important. Cooperation and collaboration. It is very important at the regional level, at the national level, and at the continental level. African Union needs to sit up. Regional bodies need to sit up, WAU and other regional bodies. And it's time for everybody to wake up. I think that is a clear call. We all have to wake up and address our issues. So thank you very much, Dr. Tosin, for your contribution. We sincerely appreciate it.
Thank you.
And
Thank you.
I know our participants, you have 1 or 2 questions for Dr. Tosin. You can go to the question and answer section of the chat box and put your questions there. Dr. Tosin will respond to it after the presentations. So we'll go straight to the next presenter. But before I hand over to the next presenter, permit me to talk briefly about one of the outputs of this webinar series, which is the webinar compendium of policy brief for the year 2023. One of the reasons, there are 2 main reasons why GETS is organizing this webinar series, and we started organizing it since 2021 at the peak of the Ebola of COVID. And we've been doing this every month for about 4 years. We are doing this for 2 main reasons. Number 1, to create awareness and provide capacity building for experts on the continent of Africa, to let people know emerging issues in the area of health security and biosecurity on the continent, and bring together experts to discuss emerging issues in the area of health security and biosecurity. The webinar was started actually at the peak of COVID. There was so much misinformation during COVID, and people started losing trust in conventional sources of information. And that was why we started this webinar then to create an unbiased source of information about COVID and other emerging health challenges. And over years, it has grown to become one of the main platforms on the continent to discuss emerging issues in the area of health security and biosecurity. And last year alone, in 2024, we had about 55 speakers speak on this platform. We had 11 different webinars, and we had about 5,000 participants from about 52 different countries. So the webinar series is growing, and we're using it as a platform for disseminating information about issues around One Health and biosecurity. And the second reason why we're doing this is not just about information dissemination, is to create a platform where we can develop policy documents from presentations from experts that can be useful for policymakers to take informed decisions in the area of health security on the continent. And that was why we came up with these documents, the Policy Brief Compendium for the year 2024, GETS webinar series. The 11 webinar series that we had in the year 2024, we've been able to develop policy briefs for each of the webinar series, having very fantastic and interesting topics in the area of health security, in the area of antimicrobial resistance, in the area of climate change and health, very fantastic topics. And we're bringing up this so that the policymakers at the African Union level, regional level, and national level can have contributions from top experts on the continent, break down these contributions into policy briefs that they can use for decision-making on the continent. One of the biggest challenges we have in Africa is the gap between researchers and policymakers. Policymakers not having a clear understanding of what researchers are doing, and researchers not being able to effectively communicate in a way that policymakers will understand. So trying to bridge this gap, that is why we're putting together this compendium, written in simple policy manners that policymakers on the continent can use for decision making. And we are going to be sharing this policy brief with policymakers on the continent at the national level, at the subnational level, at the regional level, and also at the continental level for decision-making at various levels. And we're going to be sharing it with all our participants in the year 2024. We had about 5,000 participants in the year 2024 alone. And this webinar policy document is going to be on our website, the GET website, www.getafrica.org. It's going to be on our journal website, www.getjournal.org, and even on our conference website, www.getafricaconference.org. So go look at it, share with as many researchers as possible, as many policymakers as possible. Hope that this will be a very good document that will be useful for decision making in Africa. That will be useful for policymakers, and not just policymakers, even researchers, to have a clearer understanding of topical issues in the area of health security, biosecurity, and One Health on the continent. These are one of the few things GET is doing to build capacity on the continent of Africa. And hopefully we'll share it widely with as many people as possible, and hopefully to contribute to ensuring health security and reducing biosecurity threats in Africa. So share it as wide as possible, read it, and let us have your feedback as soon as possible. So without wasting much time, I'll go straight to our next speaker. And our next speaker is Dr. Olamide Okulaja. I'm going to be reading Dr. Olamide Okulaja's bio for about 2 minutes, and I'll hand over the floor to him to speak. Dr. Olamide Okulaja is a Senior Director of Scale Program at Maisha Meds Healthcare Strategist. Is an healthcare strategist and economist. Dr. Olamide is a distinguished professional with a unique blend of expertise spanning medicine, business, and public policy, with a medical background complemented by an MBA from the University of Aberdeen and a diploma in health economics and policy from the London School of Economics. He brings a strategic and analytical approach to driving systemic change across multiple sectors. His work has been instrumental in shaping policy frameworks, fostering innovative financing mechanisms, and enhancing economic growth and public service delivery. He has played a key role in developing initiatives that integrate environmental sustainability with economic resilience, while advancing access to finance programs that empower small and medium enterprises with affordable capital. A significant milestone in his career includes contribution to the establishment of a statewide health insurance scheme that has improved access to affordable healthcare for millions. He has also spearheaded programs leveraging public-private partnership to enhance diagnostic services and healthcare delivery. During the COVID-19 pandemic, he facilitated the creation of a private sector laboratory consortium that strengthened diagnostic testing capabilities in response to the crisis. His expertise extends to development finance, healthcare system strengthening, and public-private partnerships. Having worked with international organizations to advance corporate partnership and innovative finance solutions that improve access to critical services. Dr. Olamide, we are very happy to have you on this platform today. You have the floor for about 20 minutes, please.
Thank you very much, and also very happy to be here. My name is Dr. Olamide Okulaja. I will share my screen and then we can start. Just give me a few minutes. Can you see my screen?
Yes, we can see it clearly.
Okay, thank you very much. Okay, so my topic today will essentially be strategies for financing healthcare in Africa amidst declining international support. And this is just basically an insight into health financing. And of course, my name is Dr. Olamide Okulaja. In light of recent developments, it's imperative to reassess and enhance the strategies for financing healthcare in Africa, especially amidst declining international support. And basically, it's important that we're able to ensure that we protect ourselves in a way that we're not too reliant on funding that is not ours, so that we don't get eaten up at the end of the day. One thing that is important that we need to really understand is that health needs to be paid for, and it will be paid for either directly or indirectly by the public sector or by the private sector. So basically, healthcare is not free in any way. But unfortunately, for several years, we have been sold the narrative that healthcare is free by several governments across Africa, because we have all tried to lead what I call a pseudo-socialist government, where government tries to take responsibility for providing healthcare for everyone. But unfortunately, because that has not been done effectively, we then have huge declining healthcare indices, especially in Nigeria, where Nigeria currently has if we're holding a Grammy award for Nigeria, we will win all the awards for the highest maternal mortality burden, neonatal mortality burden, and communicable, non-communicable, and other things by the sheer number of our population size. And so basically, it's important to look at the context and background, and like I said, Africa's healthcare systems have historically relied on substantial donor funding. And like the other previous speaker said, we have really not allocated as much as we should to healthcare financing in Africa. And so that gap has essentially been filled by the donor world. And the recent geopolitical shifts, including the suspension of significant aid programs, have led to abrupt funding gaps exemplified by the suspension of USAID programs that has jeopardized critical health services. And it's actually so amazing, the ricochet effect that this suspension has had, because several organizations have been affected, several millions of dollars have been suspended. And by so doing, several people that have been so reliant on the healthcare, on the donor-funded healthcare system has been affected. And this has now brought about the necessitation of a transition towards a sustainable, domestically driven healthcare financing model or models. And I've always said this for several years, and it was almost as if one was looking through a crystal ball, that healthcare cannot be treated as a socialist agenda in Africa. Not because it should not be, but because of the circumstances of our demography and our geography and our political situations that does not enable us to be able to do these things. So what are the key challenges in healthcare financing we have now? One, of course, the abrupt cessation of donor funding, our donor support. Programs like PEPFAR have faced sudden halts, disrupting services for millions. And Gavi is also facing funding constraints as donor nations reassess their commitments to these organizations. In Nigeria, we had over 90% of people that were on anti-HIV drugs reliant on donor-funded programs. And of course, we're very proud of our minister, because immediately he went to FEC and he was able to mobilize over 4 billion naira to plug the gap in the immediate instance. But unfortunately, as a health financing specialist, we consider the possibility of this continually happening, and what is the fiscal space that allows for government to suddenly take over this, this burden that it has now overtaken, especially because we are unable to generate enough money to even do other things, which we'll be able to talk about as we go ahead. And of course, again, insufficient domestic healthcare investments. When we had the Abuja Declaration, of course, we've flogged this several times in a way to sort of cajole our governments to be able to allocate more funding to healthcare, which was the 15% allocation of budgets to healthcare, but that also has not really happened. And so, again, we have minimal allocations, and you have countries contributing between 2 to 5% of their health budgets for their entire population going forward, and that, of course, as we know, is not feasible. We have fiscal pressures. We have high debt servicing and economic challenges, limiting government's capacity to allocate sufficient resources to healthcare. So, for example, in Nigeria, as at last year, our debt servicing to revenue ratio was over 90%, which basically means that the amount of money we were generating as a country, over 90% of that was used to pay interest on our debt. And you can then imagine what is left to be able to fund the budget that we had. And we usually have a deficit of about 70% in terms of revenue generated and revenue required, with majority of that going into recurrent expenditure. And so by the time government then borrows money to pay for recurrent expenditures, you can now imagine how much money is required to actually develop a healthcare system and actually allocate resources required to a healthcare system. The high out-of-pocket expenditure is magnanimous. Over 150 million Africans are pushed into poverty annually due to healthcare costs. And in Nigeria, specifically, you have about 77.9% of our population paying out of pocket for a total healthcare expenditure of about $16.1 billion. So you can imagine the amount of monies that the poor and the middle class are churning out to pay for healthcare. And of course, no wonder that they're being pushed into poverty. We also have economic constraints because, projected economic growth remains modest, limiting fiscal space for healthcare investments. And we have reliance on very limited structures that can actually help us generate revenue. So the strategic pillars for sustainable financing are about 5. First, you can talk about the domestic resource mobilization as it relates to taxing, where there's enhancing internal revenue through innovative taxation and efficient collection systems. Unfortunately, this is very absent in Africa when you have a formal to informal ratio of about 20 to 80%. And so the administrative cost of efficient taxes is actually very low. The tax GDP in the country has been rebased to about 10%, and in Lagos is about 2 to 3%. And you actually look at the number of people that are actually able to pay taxes or are paying taxes in the country, it's actually very limited. So there's a huge problem in that. Health insurance is also a huge problem, but it's one of the strategic pillars for sustainable financing, where broadening coverage through national schemes and community-based incentives is the way for mobilizing resources. But if you look at the indices again, it's quite limited in terms of the ability for countries to actually mobilize this as a way of financing healthcare. Public-private partnerships, leveraging private sector expertise and capital for healthcare infrastructure and services may seem the only viable way for now, because if you look at our GDP is actually quite high, with Africa's GDP ranging between $1.5 trillion. I don't know what the new figures are, but we have a high GDP. But when we look at government funding to government funding or government revenues to our GDP, you can see that there's a huge disparity, which means that a lot of the funding available in Africa lies in the private sector. So one of the ways we can actually leverage on is to see how we can partner with the private sector to be able to mitigate our healthcare infrastructure or demand side needs. We also need to begin to look at innovative financing models by adopting mechanisms such as social impact bonds and blended financing. In Nigeria, for example, the Central Bank of Nigeria recently closed their monetary policy meeting, and they kept the monetary policy rate at 27.75%. For a lot of people that don't understand what that means, it means that that is what the central bank is putting as a levy on every loan that is going out of or to people that require funding. And that by itself, by the time other administrative charges go on top of that, on lending then ranges between 35 to 40%. And we're actually really wondering how many people have the capacity to be able to loan money at this rate, especially when you are delivering services to people that have difficulty in actually providing those services, in terms of the poverty index that is in Nigeria, and by extension in Africa. And of course, one of the things that we also need to look at is efficient resource utilization, where we're able to get more money out, more care out of every dollar that is spent. But of course, we need to do this through optimizing existing funds through transparency and accountability. But public finance management has been a huge hindrance to making this happen in several African countries. And so one needs to actually look at how we can address those issues too. So in terms of the tax reforms that we need, the tax mobilization that needs to happen, there are different ways that we can look at. For tax reforms, we need to implement progressive taxation and earmark funds for healthcare. When we talk about progressive, we don't mean in terms of moving forward. It means in terms of looking at percentage of earnings of people as against a flat rate, what is referred to as a regressive system. But unfortunately, if you have a formal to informal ratio of 20 to 80%, it's very difficult to collect progressively because you do not have an overview of what people actually really earn. So it's difficult to tax effectively in that regard. But one of the things that I've been thinking of and we've been thinking of is to see how the healthcare system can assist government in engendering some form of tax reforms that allows for some level of progressive collections of funds that they allocate to health. And that's one of the things that's actually being explored in Lagos State. They say that there are 3 people that a person does not lie to. He does not lie to his doctor, he does not lie to his accountant, and he does not lie to his lawyer. And so if we as healthcare system can enable systems that allow people to be a bit truthful about how much they earn, then it can assist government in implementing the tax reforms that can actually help them collect more money, and by so doing, allow them to be able to allocate more funding to the healthcare system. Sin taxes is a way that has been, posited as raising funding for health. And we can say we can put levies on taxes on tobacco, alcohol, and sugary beverages to fund health initiatives. But unfortunately, when a lot of these sin taxes are collected, it's not everything that is allocated to healthcare. And sometimes none is allocated to healthcare and may be allocated elsewhere. And of course, with our governments, they usually do not want to implement tax systems because they feel that it might affect their chance as re-election, either of the individual or the parties. And so it takes a lot of courage for a government to say they want to do some form of tax reform. So a lot of governments run away from that. We need to look at natural resource revenues and allocate a portion of extractive industry profits to health sectors. This is also something that needs to be done by government. But of course, there's already a huge gap in the revenue required to actually fill up the space. So when these are done, it's a bit worrying that majority of it may actually not go to the healthcare system. So one needs to actually look at that again. And of course, there needs to be policy alignment when we ensure that donor funding is not done in isolation, but is done in a complementary way. So one of the things that the Minister of Health in Nigeria has done, he has implemented a program called SWAP, where there is a basket fund and donors are encouraged to put into that basket fund in addition to government, and that is used to facilitate a cohesive healthcare strengthening system. So those are some of the ways we can look at that. For expanding health insurance coverage, it's important that health insurance is implemented, and not just implemented, a mandatory health insurance system is implemented, and there must be a way of enforcing that mandatory health insurance. So for example, in Lagos State is looking at, as the executive governor released an executive order stating that anyone that does not have a social health insurance scheme cannot do any business with any MDA, ministries, departments, or agencies in Lagos. And at the same time, you cannot access care in any public or private facility. So these are sort of the ways that Lagos is looking at enforcing the mandatory nature. And over the next couple of months, they will begin to enforce this. And this is coming on the back end of a national law of the National Health Insurance Authority mandating that social health insurance is now mandatory, especially through the state health insurance scheme. So there needs to be a partnership between the federal and the states and the counties to be able to enforce mandatory insurance and ensure that those that can actually contribute to a pool actually contribute. Community-based health insurance schemes have not been touted as a way that can be used to raise financing for healthcare, especially because majority of them are voluntary and the people that resources are being collected from are actually not as viable financially as they should be. However, in a situation where we have a high informal sector and we have a huge rural to urban separation, we can actually leverage on some community-based health insurance schemes to actually add to a basket of funding or pooling of funding that can actually contribute to healthcare systems. And of course, we need to be able to engage with the private sector to be flexible around developing health insurance products that will not only allow for those that cannot afford the big ones, but allow for some level of cross-subsidization and risk equalization to be able to fund the entire ecosystem. So one of the things that Lagos is considering is partnering with their private health management agent organizations, health HMOs, to assist in incorporating the social health insurance scheme into their plans and in a progressive fashion, deduct some revenues that will then allow for an equitable distribution for those that cannot pay. Again, one of the ways that we can achieve healthcare financing going forward is leveraging on public-private partnerships, infrastructural development. If we're able to implement a mandatory health insurance scheme and enforce it, what that does is that it creates a stimulus for those that have money to be able to invest in the supply side. And so we can collaborate with private entities to build and maintain healthcare facilities with a guarantee that funding will come soon and they will be able to recoup their funding over a period of time. If we're able to demonstrate this, then of course you see an increase in investments in healthcare. We can also look at service delivery innovations where we outsource specific services like diagnostics to enhance efficiency, because there are different ways to skin a cat. Sometimes when you try to solve a problem holistically, it becomes more expensive. But when you sort of like break it down and then allocate specific services for specialization, then it's easier to outsource and easier to swallow in terms of funding those interventions. And of course, we can look at investment funds utilizing platforms like Transform Health Fund to bridge financing gaps. When we are implementing innovative financing mechanisms, we can look at blended financing, combining public and private investments to mitigate risk and attract capital. We can look at social impact bonds by raising funds from investors repaid by outcomes achieved in health projects. We can look at crowdfunding and diaspora bonds by engaging the diaspora community to invest in homeland health projects. And this is one of the big opportunities that we have, because when you look at remittances, it's a huge sum of money, and we can look at how we can sort of like appeal to these groups to be able to crowdfund and look at a way that they can also benefit from this crowdfunding by creating some bonding to that. We can look at making our systems more efficient by implementing digital health solutions, by leveraging mobile platforms for healthcare payments and insurance enrollment. And it was so funny because I did a study a few years ago, and I was, the country that had implemented a huge amount of their population into health insurance, especially their informal sector, was Kenya. And they had about 17% of their informal sector in their health insurance scheme. And I wondered, I said, how did they do this? Was it because of their health insurance programs or the health service delivery? But in digging deeper, the only reason why they had such a high number was because of their M-Pesa, their ability to facilitate repayments. And so by creating the M-Pesa platform or the Intiba platform, they were able to facilitate easy repayment of health insurance schemes. So they were able to maintain a high level of people that were able to pay through that. Now we also need to look at optimizing resources and allocation and efficiency. We need to look at how we can facilitate public financial management reforms by enhancing transparency and accountability in healthcare spending. We need to look at performance-based financing. A lot of times, when we look at our financing mechanism, we look at funding inputs as against outputs. There was a time we're looking at setting up primary healthcare centers, and we took a look at a list of what was required to set up a primary healthcare center. And of course, by the time it was done, little wonder why, there was a lot of allocation for this and we're not seeing anything, because it was such a huge amount. But when you look at the services coming out of those centers, they're actually quite poor. So what we need to look at now is to target a situation where we link payments to outcomes and outputs as against inputs. We also need to look at technology integration, where we adopt health information systems to streamline operations and reduce waste. So there are different case studies of successful strategies. The Rwandan CBHI that has achieved over 90% health insurance coverage through community engagement. Ghana offers insights into scaling national health insurance amidst economic challenges. Nigeria has looked at several innovations, like I've mentioned before, and also securing $5 million loans from the World Bank to enhance primary healthcare services. And of course, South Africa's NHI, which aims to provide universal healthcare coverage despite facing several resistance. So what are the policy recommendations? One, to prioritize health in national budgets to aim for at least 15% allocation as per the Abuja Declaration, to strengthen health governance and enhance regulatory frameworks to build trust and attract investments, to enhance our health insurance schemes by implementing reforms to expand coverage and ensuring financial sustainability, to foster PPPs by creating conducive environments for private sector participation through care policies and incentives, to promote transparency and implement robust monitoring and evaluation frameworks, to build trust and ensure effective use of funds, to foster regional collaboration and share resources and strategies through platforms like the African Union, and to encourage donor alignment by aligning international aid with national health priorities for cohesive development. So the call to action is a multi-sectoral engagement to collaborate across sectors to address social determinants of healthcare, community involvement by empowering local populations in healthcare decision-making processes, innovative financing approaches by exploring and piloting new models to diversify health funding sources, and advocating for policy reforms to engage in dialogue to influence health financing policies at all levels. I want to end by saying that no nation can base the financing of its growth and development solely on the goodwill of other nations. Free and borrowing are phrases that are not sustainable, and they are not a sustainable resource mobilization strategy. Thank you very much for giving me the opportunity to speak to you today. Thank you.
Yeah, thank you very much, Dr. Okulaja, for that very detailed analysis of what the solutions are on the continent of Africa. Your presentation shows clearly, I wish you have as a lot of policymakers on the continent listening to you, because it breaks down different aspects of possible solutions to solving the emerging issues we're having on the continent. Truth is that it's all about the money, and what you don't know, you don't know. And your presentation gives a detailed explanation of where the money can be. How can we look inward within the continent of Africa to use what we have to solve emerging problems on the continent, especially with regards to funding healthcare in Africa. And you started clearly by saying that it's clear that there's no free lunch in London. There's nothing that's free actually. If it's free, somebody is paying for it somewhere. And we can't just see the health system or financing the health system cannot be on donor funding, and it cannot absolutely be a social approach system. We have to look for ways of raising financing within the continents and within the countries to address and solve the health finance challenges on the continent. And you talked about the challenges. You talked about, definitely sudden cessation of funding from international organizations and countries, insufficient domestic health investments, fiscal pressure. Like you said, most of the budget or the money we make on the continent, especially Nigeria, goes into financing loans. And about 90% of what we generate on the continent on Nigeria goes into financing loans and leaves very little to development. and high economic constraints and other issues that are challenges to available finance to address emerging issues on the continent. And we talk about the strategies, what we need to do, PPP, public-private partnership, innovative financing modeling that's very important, efficient resource utilization, health insurance, and domestic resource mobilization. It's all about looking inward, whether we are considering PPP, considering expanding health insurance, increasing domestic resource mobilization. Like Africa, you don't agree that 15% of budget should go into health financing, but less than 30% of African countries doing that. And talk about the various aspects of taxing, tax reforms, sin tax, and the other aspect of taxing that we can engage in to generate or raise finance for health systems in Africa. Talk about blended finance, about digital health solutions, and many other aspects. I will give examples of case studies in Rwanda, in Ghana, in Nigeria, and in South Africa. Spoke about policy recommendations and call to action. That was a very, very detailed presentation, and I'm sure a whole lot of participants have learned so much. Hopefully, you give us the permission to share your presentation with our participants. And like I said, we are going to develop a policy brief from this presentation, which we're going to share with all our participants. But hopefully, our speakers will give us the permission, and we're going to share their presentations with participants after this webinar. So without wasting much time, we'll go straight to the next speaker. But before I go to the next speaker, can I briefly talk about another activities that we are having in GET this year, and that is the GET annual conference on One Health and biosecurity. GET organizes a conference on One Health and biosecurity. We've been doing this in different countries in the last 11 years. We've had the conference in Ghana, in Sierra Leone, in Senegal, in Abuja, Nigeria, and in Lagos in the last few years. And it has grown to become one of the biggest platforms, transdisciplinary platforms to discuss emerging issues in the area of One Health and biosecurity. And this year we're focusing on artificial intelligence. The theme for this year is artificial intelligence and biosecurity, governance, opportunities, and risk for Africa. You agree with me that AI in the year 2025 was what internet was in the year 1990s. He has the ability to address a whole lot of emerging problems, and is doing that already in different parts of the world. And Africa must join this chariot. We have to see how we can maximize the opportunities that AI offers within the continent, and at the same time, working on governance structures to reduce the risk and understanding clearly the business around AI and maximizing the opportunities on the continent of Africa. The conference will be coming up in November, from 5th to 7th November 2025. And the call for abstract is already out. You can submit your abstract website, www.getafricanconference.org. You can submit your abstract there. And registration is already on, so you can go to the website to register, www.getafricanconference.org. Please visit the website, register, submit your abstracts, and let's come together in November to discuss emerging issues in the area of artificial intelligence and health security on the continent. How do we maximize the opportunity? What are the research around it? What is the governance structure that we need to put in place to prevent the risk? And what is the business around AI all over the world? And how can Africa maximize the business around artificial intelligence, especially in the health sector? This conference promised to attract about 500 experts, transdisciplinary experts from all over the world, policymakers, top government officials, researchers, private sector experts, coming together to discuss emerging issues, the area of AI and biosecurity. Please register, submit your abstracts, and plan to be part of it in November. It's coming up in Lagos, November, from the 5th to the 7th of November, 2025. So without wasting much time, I'll go straight to the next speaker. The next speaker is Dr. Juliet Nabunga Ore. I hope I pronounced the name well, Dr. Juliet. I'll read your bio for about 2 minutes and hand over the floor to you. Dr. Juliet is a medical doctor and health economist whose main area of work includes health economics, policy development, and strategic planning, designing and monitoring health sector reforms, health financing, health system, performance assessment, M&E, health system partnership, and knowledge translation. Dr. Juliet works for the WHO regional office in Africa, and she's a health system expert with experience spanning over 2 decades. She has been instrumental to the transformation of health systems in many African countries. She has published extensively in the area of health systems and services, health financing, and health economics. She's a member of the Scientific Committee of the European and Developing Countries Clinical Trials Partnership Joint Undertaking, and formerly a member of the Portfolio Board for Global Development and International Relations of the Research Council of Norway. With a multidisciplinary approach to leadership, his work continues to drive impactful initiatives and the intersection of healthcare, economic development, and sustainability, contributing to transformative change in Nigeria and other countries in Africa. Dr. Juliet, we are so happy to have you with us today. Please, you have the floor for about 20 minutes.
Thank you so much for having me. And let me share the slides from my side.
Yes, please go on, please.
Okay, let me know whether my slides are up. Is it all right?
Yes, we can see your slide now.
Excellent. So I'll take it on. Thank you so much for inviting me to this meeting. And in the next few minutes, I'll speak to the governance and policy reforms for sustainable financing in Africa. I think I have problems moving the slides. Perhaps I let you share if that will be easier.
Okay.
Okay, I guess you share from your side. Maybe it will be easier that way.
Okay, Secretary, please share Dr. Juliet's slides.
Excellent. So, okay, let me have the next slide, please. In the next few minutes, I'll speak to why reforms are important and what are the important policy and governance reforms. And then I'll also speak to what will it take for us to realize the utility of these policy and governance reforms, and then I'll conclude. Next slide, please. So why do we need reforms? We are concerned with the low government financing for health. And the previous speakers have touched on this topic. Both Dr. Tosi and Dr. Olamide touched on this point. Government financing for health is too low. And why is it that I emphasize government financing? Because from the health financing perspective, we know this is the best option to ensure sufficient levels of repayment and pooling. But also, if we recall, at the time of launching the Sustainable Development Agenda, the understanding then was that these would be predominantly be funded from government sources. And I think now we are talking about 80 to 100% of required amounts to finance health services coming from governments. We have estimates to deliver an essential package of health services provided to us by the World Health Organization, estimating that low-income countries need to spend around $112 US per capita, and low middle-income countries slightly higher, $146 US per capita. Now, taking it to the 80% as the minimum spending requirement, we are looking at $90 US per capita for low-income countries and 117 for low middle-income countries. But what do we say? And this is data from 2022. 38 countries in Africa are spending less than $50 US per capita on health, way below required amounts. Next slide, please. And what does this mean then? That the burden of financing health is pushed to households. We know for us to realize financial risk protection, which actually is a major component of universal health coverage, out-of-pocket spending on health as a percentage of current spending should be lower than 25%. But when you look at the bar chart, we see that 28 countries, and this is data from the WHO African region, in 28 countries, out-of-pocket spending as a percentage of current health expenditure is over 25%. And of course, we are concerned with the countries on the extreme right, where out-of-pocket spending as a percentage of current health expenditure is over 50%. This presents a financial burden to households and pushes households deeper into poverty. For example, we know data from 2019, and this is from population-based surveys, the income and expenditure surveys, that 219 million people faced any form of financial hardship. Either they fell below the poverty line, as we see 140 million people were pushed below the poverty line because they had to pay for health services. 10 million people fell deeper into poverty. They were already below the poverty line and they sank deeper into poverty because they had to pay for health services. And we have 95 million people who had to cut back on other essential spending because they had to pay for health. And they were spending more than 10% of their household expenditure on health, which means they have to cut back on other necessities of life because of health costs. Next slide, please. And I want to talk about this slide, the drivers of out-of-pocket funding, because I'll come back to this point when I talk about what does it take. Medicines is the highest driver of out-of-pocket spending. And this is for a few countries where data could allow this disaggregated analysis. And that's what we have on the slide. Next slide, please. We're also concerned about fragmentation. And I want to speak to fragmentation in health financing. And I draw from the example from Ethiopia. And we have sources of financing on the extreme right, and then we have the different funds where funds flow through to purchasing health services. And if we are to look at, for example, external financing, which is the light orange bar, we see that donors put funds into government budget, into the essential healthcare package, community-based health insurance package, fee waiver for indigents package. All these funds have administrative costs to them, have structures to them, have processes to them, which leads to, in itself is a source of inefficiency. Because you pay administrative costs and also you pay for other processes, and that's a duplication in health spending. Now, perhaps if you've worked in Africa, you realize that actually fragmentation defines much of what we do, both in health systems, but also in health services delivery. We are concerned about fragmentation in health information systems. The information systems, as many as the programs being supported, and all of them print tools, recruit people, generate data, and all this costs money. You can say the same about service delivery, where we have health workers in health facilities who only attend to the ARV clinic, despite staff shortages in other clinic in the same health facility. Next slide, please. So we need to reduce inefficiency in health spending, and Dr. Olamide touched on this, but I want to put figures to it. We've done analysis across the WHO African region, and now we know that health systems are only 23% efficient. And what does this mean? That 1 in every $5 invested is lost in technical inefficiency. And taking it to figures, in 2019, in the 47 member states of WHO, $23 billion were lost in inefficiency. Next slide, please. Now, I want to turn to what are the policy and governance reforms. I wanted to give that background of why we are concerned and what reforms are we looking at, such that we tackle problems that we know we've studied and we've documented. So let's go to the next slide, please. Dr. Olamide touched on the issue of public financial management reforms, and I want to speak to this as a reform that is important in tackling inefficiency. We see a mismatch between health priorities and budget classification. Most of the budgets align input budgets. We talk of personnel, we talk of goods and services, we talk of infrastructure, and so on. These are inputs into health service delivery. But in the health sector, we are concerned with actual results. We are concerned with better coverage of interventions, better quality of care, reaching the vulnerable. So it makes this so difficult to promote accountability in such a budget setup. So that's why most countries now are moving into program and performance-based budgeting to allow that opportunity to allocate resources in line with the priorities, to allow room for accountability and reporting, and also to allow room to be sure what it is that you can buy with the resources that you have, and also to focus on the priority needs of populations. Next slide, please. When we get to budget execution, and I only speak to a few of these as I emphasize the need for PFM reforms. And here we see that there are problems that are within the health sector, but there are also problems that are above the health sector, perhaps at the Ministry of Finance level. And we need to tackle problems at the different levels. So we need reforms that touch on what it is the Ministry of Finance does, and also reforms that speak to what the health sector does in order for us to ensure efficient PFM reforms and the value for money. I think we all know that there are delays in disbursements oftentimes. And this is not uncommon for ministries of health to return money to Treasury because they've failed to absorb this money within a given financial year, partly because funds were released late. The inadequate budget ceilings prevent effective planning for priorities, which skews planning in the other way, that you fit into the money that you do have, as opposed to looking at what are the health priorities and allocating resources to that. But also in the health sector, there are also weaknesses. Oftentimes, a wage bill is released for recruitment of staff, and this has been a problem. Wage bill, I think, is one of the allocations that is returned to Treasury because the health sector has failed to recruit. And of course, this has far-reaching consequences. We cannot realize service delivery. So which means some of the inputs actually into health services, I think partly it explains also the expired medicines because there are no people to prescribe and dispense the medicines. Delays in procurement is also another issue that has led to inefficiencies. A lack of capacity, especially when it comes to budget negotiation. The health sector is rarely on the table to put its case across, but also with data and building a good investment case to stimulate investment has been a challenge. And I think this is also another area that has to be tackled as we talk of PFM reforms. But also, as I talk about improving efficiency and talking about PFM reforms, I want to emphasize that improving efficiency is not only a health financing issue. It's an issue that also touches on other aspects. For example, I gave an example of out-of-pocket driven by expenditure on medicines, expenditure in medicines, and we can say that this speaks to having very good essential medicines list that address the health needs of the population. That's not a health financing issue. So the point I'm making that in addressing efficiency, we need reforms beyond within the health financing space alone. Next slide, please. Let's go to the next slide, please. Yes, again, speaking to efficiency, again, Dr. Olamide touched on this issue. We need reforms to buy smart, strategic purchasing to improve efficiency in health spending. We have some good lessons from Rwanda that have implemented performance-based financing where money follows results. So Rwanda and Cameroon have good lessons to share with us. They've been able to buy more health services, to provide more health outputs within the budgets without increasing budgets significantly. Another reform around strategic purchasing is contracting. This is an upcoming area in African countries, but also I want to emphasize that we need to build capacity before we can fully exploit the potential it accords. The capacity to draft contracts, the capacity to negotiate contracts, the capacity to monitor contracts needs to be built before we can talk of scaling this up in more countries on the continent. That, having said that, we learned from the case of Lesotho, where management of the hospital was contracted to a private sector. And the government greatly expanded the scope, quality, and volume of health services through the new National Referral Hospital, with only a minimal increase in annual operating costs, only 7.5%. So we can learn from this and see where can we adopt this in order to improve efficiency in our health spending. Next slide, please. Please, let's move on. No, sorry. No, please go back. I don't know what's happening to. Next slide, please. Okay, now the third reform I want to talk about is strengthening governance, accountability, and transparency. Again, Dr. Olamide touched very briefly on this to tackle corruption. Obina et al. Have studied corruption in the 18 countries in West Africa, and they've identified 5 types of corruption in the health sector: absenteeism, diversion of patients from public to the private sector, inappropriate prescribing, informal payments, and the outright theft of drugs and supplies. But also we draw lessons from the global perspective, where Patricia Garcia has also estimated the cost of corruption and reports that 10 to 25% of global spending is lost directly through corruption. And putting these laws to appreciate what it means, it says that loss to corruption exceeds WHO's estimation of the amount needed annually to fill the gap in assuring universal health coverage globally. So what does this mean? That when you talk of creating fiscal space, I think tackling inefficiency, tackling corruption, I think we can expand fiscal space from these two, even before we really put a lot of effort on more money. Because if we don't tackle these two, even more funds that are mobilized to fund health services will suffer the same fate, will be lost to inefficiency, and part of it will be lost through corruption. So actually, this forms the foundation of us going forward in financing health services in Africa. Next slide, please. Now, I was happy to read on the chat. A colleague said that we talk of funding health services, we need to emphasize prevention. I think when we talk about sustainable health financing, there are 3 things that I would like to emphasize here. That we need to look at reducing the cost of health services. We need to reduce the need for health services, and we need to look at keeping people away from hospitals, keeping them healthy in the first place. And what does this mean? That we will need reforms beyond reforms in the health sector alone. And I want to draw from the example of Seychelles that has sustainably implemented reforms over 4 decades. Irrespective of changes in the government, the vision has been upheld. On the upper part of this slide, you see the government agenda that made a commitment to invest extensively in social reforms: free compulsory education, access to good sanitation, road infrastructure, school health programs, free housing for the poor, subsidies for the unemployed. And alongside that, there were also ongoing reforms within the health sector: the free health services, functional referral, home care services, health promotion, mobilization of communities for health. And this is over 40 years. But where is Seychelles today? I think it's one of the leading countries nearly achieving UHC. For example, look at access to basic sanitation is at 100%. Out of pocket, as a percentage of current health spending is only 2.6%. Sorry, it's 14%. And only 2.6% of the population is facing financial hardship in accessing health services. So I think the point here is that a sustainable health financing is more than a health financing issue. It's a social issue, it's a multi-sector issue, it's a long-term issue. It takes building vision, sustaining that vision, and investing sustainably in that over a long period. Next slide, please. So I want to conclude, and here I speak to what will it take. That to ensure sustainable health financing requires a whole of health system approach. Implement reforms that ensure sustainable availability of medicines. We need human resource for health reforms that ensure that the absenteeism issue is no longer a problem. We have skilled, equitably distributed health workers who serve the population well. It's a whole of government approach. There's some things we need to do. And any reform you talk about, because even PFM alone, we need some work in at the Minister of Finance level, we need some work within the Minister of Health. And also when we talk of sustainable health financing, we need reforms in social sectors. We also need reforms within the health sector. So we are talking of a whole of health system and a whole of government approach to ensure sustainable financing for health. What will it take? Sustained and long-term action. Reforms are not a quick fix. It requires sustained long-term action. I've talked about the reforms of Seychelles, but we can also read about the reforms of Mexico. It followed the same path. Decades and decades of sustained investment and action. We need to strengthen governance, strong leadership, and the strong leadership of government is crucial. And here I want to emphasize that when we talk of governance, we are talking about governance at all levels of the health system, not only at the national level Minister of Health, but we're also talking of broader governance beyond the health sector, because like Dr. Lamide talked about the public-private partnership. And what we've learned over the years that you cannot have a strong public-private partnership solely housed within the health sector. We need a government-wide position on public-private partnership. And then the health sector public-private partnership can draw from that higher mandate to be effective at a stronger level. But also governance is also important, because even at the health facility level, there are some governance decisions that are made on a day-to-day. So we are talking about governance at a macro level, and we are talking about strengthening governance at the different levels of the health system. And this is very important to increase investment in health, tackle corruption, reduce fragmentations, and ensure sustained investment in reforms and multi-sector approaches. So I think this is my last slide, and I thank you very much.
Thank you very much, Dr. Juliet, for this very detailed and informative presentation. I've learned so much from your presentation. And this webinar, the first speaker talked about the impact of reduced funding or edge financing on the health system in Africa. The second speaker talked about what are the solutions? How can we look inward and raise funds to finance health system in Africa? While Dr. Juliet, the third speaker, talked about what are the necessary reforms that we need to do on the continent to make sure that we have a sustained and sustainable health finance system on the continent. And like other speakers, she started by saying that we are having reduced funding. Health system financing in Africa is reduced. African government agreed to allocate 15% of their budget to health financing, but very few African countries are meeting up to that. And because of that, we're seeing people out of pocket expenses spending on health system or healthcare increasing. And this is increasing poverty on the continent of Africa. And it is very important for us to have some reforms to ensure that we can effectively fund healthcare on the continent. And she listed some reforms, or she discussed some reforms. And the first thing she talked about is the inefficiency in health systems in Africa. She said about Africa, the health system in Africa is about 23% efficient, and that is very low. And we lost about $22 billion to inefficiency on the continent, and that is alarming. And if we can reduce that significantly, that will address a whole lot of financing issues that we're having on the continent. And she talked about some policies, public finance management reforms, which is very important. She talked about strategic purchasing to improve efficiency in health systems. And she talked about strengthening governance to enhance accountability and transparency. And about 10 to 25% of health financing of funding in the health sector in Africa is lost to corruption. So if we can reduce that drastically, that will increase the available money available to do substantial activities in the health sector on the continent. And she talked about preventive medicine. And I strongly believe that on the continent of Africa, preventive medicine is very important. We have to find a way of increasing all other aspects of socio-political aspects that can lead to ensuring preventive medicine on the continent, making sure that people don't go to hospital, ensuring that we have good sanitations, good road system, good educational systems, and other systems that can enhance preventive medicine on the continent. This will reduce drastically the amount of money that we're spend on healthcare on the continent, and ensure that people don't go to hospital as often as they go to presently on the continent. So preventive medicine is an area that we have to look into on the continent. And once we start expanding all other aspects related to medicine directly to healthcare, environment, improving on our environment, improving on our infrastructural systems, and other health-related issues. Definitely, we will need to spend less on health itself, and that will enhance the health of countries on the continent. So preventive medicine is very important. And she concluded that addressing the issues of health financing in Africa, there is need for a whole of health system and whole of government approach. And we need to strengthen government. And reform is not something that happens in 1 week. It's not something that happens in 1 month or 1 year. It's a continuous process. And we need a strong governance system for us to effectively ensure reform or conduct necessary reforms on the continent of Africa to ensure that we have the necessary finance that we need to finance the health systems on the continent. Strong system, whole of health system, and whole of government approach is what is needed to ensure reforms on the continent. So thank you very much, Dr. Juliet, for that very detailed presentation. And we'll sincerely appreciate your contribution. And hopefully too, Dr. Juliet will give us permission to share our slides with our participants, so that I'm sure there's still so much they will learn from your presentation. And like I said, we are going to develop a policy document from this webinar. So much information has gone out in the last 1.5 hours, and it's very important for us to document this and share it with relevant policymakers for decision-making and solution to challenges, especially in the area of health financing on the continent. And gradually, we're coming to the end of the webinar today. And one key message that have gone out, the presenters has been talking about in the 3 presentations, is the issue of collaboration and fighting partnership and collaboration, especially within the continent. The issue of health finances is not just a government issue. It affects the private sector, and especially even the non-governmental organizations that depend on international funding for a whole lot of their activities. and get to bring an international organization that is clearly thinking about sustainability and areas of fundraising to address emerging challenges that's facing us as an organization and to raise funds for most of our activities. We're looking into partnership and collaborations with organizations both within and outside Africa, both for the webinar and for many other activities we're doing within the organization, within GET. So one of the partners or partnership that we've developed this year and we're working together is an organization that we call Early and War Healthcare and Business Consulting. They're called business consulting organization with that the headquarters based in Nigeria, and we're developing partnership with them on series of activities. And one of them is this GET webinar series, working with them in publicity, with business design, marketing, and many other important areas. And today I have the CEO of Early and War Healthcare Business Consulting with us. He will speaking to us for about 5 minutes before we'll round up this program. His name is Dr. Ademola Owoyele. Dr. Owoyele, it's nice having you on the program today. You have the floor to talk for about 5 minutes.
Yeah, thank you, Dr. Bobadoye. Thank you very much for having me today. I think it's been a fantastic session from all the presenters. I want to thank the speakers. They've brought a lot of insight to the discussion here today. Without taking much of your time, I think there's a particular point I would like to begin with by taking from what the presenters have said. The likes of Dr. Okulaja, the likes of Dr. Tosin, then Dr. Juliet herself. I think one point I would like to pick from this is gone are the days where we think healthcare is free. This is important. Gone are the days where we think healthcare is free. Healthcare is not free. Somebody pays for it. And what it means is that if we understand that healthcare is not free, what it means is that we need to treat healthcare as a business. And when I say we treat healthcare as a business, what I mean is that we need to see how you can add value. You can actually treat healthcare as a business by number one, how does it add value? Number two, how does it improve your profitability? So this is the reason why we have Early and War Healthcare and Business Consulting. It's important for every healthcare worker out there. It's important for every doctor out there to see healthcare as a business. Now, the thing is, how do you add value to the system? Number one, you must ensure that whatever you spend in healthcare gives you equal result or superior value. Number two, the other part of it is that you need to be able to get profitability for whatever you invest. And this is the reason why, more important for me, beyond the strategies to combat the new cessation or termination of funding in foreign aid, is the fact that we need to look at what we call SEA. Number one, sustainability measures. Number two, efficiency measures. Number three, accountability. If we do not look at a system whereby we can actually fund our healthcare system sustainably. When I say sustainably, it means that we have to ensure that there's returns on whatever we invest. Now, there is no way you can actually fund a system sustainably if you don't get whatever you put in back. So this is the reason why healthcare workers must think of healthcare as a business. And this is what Early and War Healthcare and Business Consulting does. To open up the mind of doctors, to open up the mind of people, to open the mind of healthcare workers, to see healthcare as a business. Beyond the fact that the Minister of Health brings in 4 billion naira, the first thing we need to do is, are we getting the right result from whatever we have invested into healthcare? There's a lot of corruption, just like Dr. Juliet said, there's a lot of corruption going in the spends. What is the reason why Donald Trump is actually stopping USAID? It's because they feel that there's a lot of inefficiency going on. So if we do not make ourselves more accountable for whatever we put into healthcare, if we do not make ourselves the system more transparent, if we do not stop corruption that goes on in the entire system, we're going to be going on in circles. And this is the reason why Early and War Healthcare and Business Consulting is partnering with GET to see how we can open up the minds of healthcare workers to be more entrepreneurial, to be more business-minded, So that now ask yourself also, why is it that healthcare businesses are not sustainable? You open up a hospital today, you realize that in the next 10 years, 15, 20 years, healthcare businesses do not go from 1 branch to 2 branches to 5 branches to 10 branches. It's because most times our doctors are not entrepreneurial. They do not understand how to grow healthcare businesses. And these are some of the things where we need to, as a people, come together to improve our knowledge. And this is what Healthcare and Business Consulting does. So what we do is that we apply, we have a group of consultants who have global expertise from all over the country, all over the continent, and have come together to apply their skills to local programs, to see how we can transform healthcare businesses towards making them more sustainable, towards making them last the test of time. And this is why we're going to be doing with GET for the next 1 year to see how we can, just as we have over there, it's been shared. These are some of the trainings we've been doing. So what we do is that we train healthcare workers on so many different things, on leadership skills, on management skills, on business skills, on entrepreneurial skills. The next slide over there is some of our consultants. We have a whole lot of them. Some of them specialized in investment, some of them specialized in in financing, some of them specialized in marketing. And what we've done is that, and also in clinical operations, we also come into hospital operations to see how we can make hospital operations better, transform them financially, quality-wise, improve the quality outcomes of businesses. So I want to thank you for having me here today. Thank you for your time. Thank you, everybody.
Thank you very much, Dr. Woyele. It's great partnering with you, and it's great having you on this platform. Like everybody has agreed, it's all about the business. It's all about being efficient. And it's all about raising the right amount of finance to support the healthcare system on the continent, whether the private sector or the public sector. So we're coming close to the end of this webinar again today. And before we close, we'll give opportunity to one of our participants to speak for about 2 to 3 minutes. If you are interested to speak, I think Professor Tomori is online. Prof, if you are interested, we can unmute your system and you can speak for about 2 to 3 minutes before we take 1 or 2 questions from our participants and end today's webinar. Professor Tomori, please.
On something that is so elementary. So I think it's a point that many of the committee members have observed, that the quality of the data has improved significantly since the previous presentations. And those were the ones in August, and even with the ones that we were there in person in Addis. But it's not just the quality of the data, it's also the quality of the analysis. And so I want to ask Kian.
Okay. Secretary, can you unmute Professor Tomori to speak, please? Secretariat. My body. They have 5 people in that office.
Yes,
He
can speak.
Hello, can you hear me?
Yes, he has permission to speak.
Hello.
We can hear you. Please go ahead.
Yeah, thank you very much. My name is Tomori, and thank you for all the presentations and all that. Well, I just wanted to make a point that there's nothing new in what we have had. It's just that we refuse to do what we need to do in Africa. We know where the problem is. We know what we need to do, but we'd rather not do that. We hold conferences after conferences every day, everywhere, talking the same thing year in, year out. And yet when it is put your money where your mouth is, you refuse to do that. Tell me, I'm looking at my own little country where I am from. Only a few days ago, we had the launching by Bupa, one of our politicians. And within a few hours, they raised 16 billion. Try that for health. You won't find anybody to put any money into it. Why are we not putting our efforts on where we know where our problem is? Why are we depending on foreign aid to get to our things done? I was making a point the other day. If I have an emergency like this US, whatever, all this donor thing, which again, me and donors, I don't agree with them because 3/4 of what they're giving to us gets back to them in one form or the other. But let them assume, let them take all their money away. We have an emergency in our hand. It's like me, I have an emergency. My child has to go to school and I have to pay that school fees. And I'm thinking of getting a shoe for myself. I'd rather pay that school fees than and work with bare leg, because I know that's an emergency that we take care of. Why is Africa not doing that one? Why are we depending on foreign aid and all those kind of things when we have enough resources? And I mean resources, they call us resource limited. We are not resource limited. We are resource wasteful, we're resource squandering. Why are we not doing what we need to do? Instead of holding meetings and meetings and meetings every year in, year out, and not doing the same thing. I've been hearing this type of thing since 1994, almost the time I started speaking English. Why are we not putting our money where it is? In my country, for example, I go to the Department of Disease Surveillance. They don't have a bicycle to even go and investigate the disease. Yet my governor will move from his toilet to his bedroom with 20 cars following him. And then you want donors to come and help you. Please, let's talk on what needs to be talked on. Forget all these theories we're talking about. Yes, corruption is the main important thing. Let us go to what we need to do and do it. Thank you, sir.
Taking away all the resources from the market.
Thank you very much, Prof, for that very frank contribution. It's all about doing it. Just do it. I think that is the watchword. And the truth is that we don't have an option now. It's either we'll do it or we'll go down. So I think Trump, in a way, is the president of America, in a way, is helping African countries and other countries all over the world to stay up. Everybody must look inside and look for innovative ways of taking the right decisions now. So either you do it or you go down. So thank you very much, Professor Tomori, for that very frank contribution. And we're coming close to the end of this webinar today. I just checked the question and answer section, and I'm seeing about 19 different questions. That shows how interesting the webinar today is. But unfortunately, we're behind schedule, and it's almost impossible for us to respond, for the speakers to respond to the questions today. I think I'll just take one question and allow the 3 speakers to respond. Then we'll address the remaining questions, send it to them, and we'll send their response to our participants. So let me just take one question and allow them to respond to it. It's from Fungai from Zimbabwe, and he or she says, is it possible for African Union to cover the gap left by funding withdrawal of US? Do we have the fund on the continent to cover it? That is our question. I'm going to allow the 3 speakers to respond to that, starting from Dr. Tosin, Dr. Lamide, and Dr. Juliet.
I would say yes. There's capacity on the continent to fill that gap. Dr. Lamide mentioned several financial models that can be implemented. We have the resources, and Professor Tomori also mentioned that it's high time we prioritize health, and also looking at health as a business, we'll find a revenue within the continent to be able to address the gap. Thank you.
Dr. Lamide, please. See, Dr. Juliet, can you respond?
Yes, thank you. I think I want to align with Dr. Tosini's response, but I would like to take it to country level, that yes, it's possible. And indeed, she cited some examples. I think Nigeria was an example. And Professor Timori has also touched on some examples where there's been a capacity to mobilize resources. I think it's an issue of political will and commitment. But also, even before mobilizing more resources, can we talk of tackling corruption? Can we talk of improving efficiency and see what else remains to be mobilized? I think the answer is yes, and action should primarily be taken at a country level. Thank you.
Thank you very much, Dr. Juliet. And we've come to the end of today's webinar. Like I said, two things we're going to do. We're going to share the PowerPoint presentations of the speakers with the participants immediately after this webinar. We're going to share the webinar certificates also with the participants, and we're going to develop a policy brief based on this webinar today and share with participants and relevant stakeholders on the continent. So before we go, I want to say a very big thank you to our speakers today, Dr. Lamido Kulaja, Dr. Tosin, and Dr. Juliet. Your presentations have opened a lot of issues, discussion issues on the continent, and I strongly believe that our participants have learned so much today, and your presentations I believe will be very useful to addressing a lot of policy challenges on the continent. Thank you very much for sharing your wealth of knowledge and experience with Africans, with fellow Africans. And I also want to say a big thank you to our participants. The only reason why we do this every month. Without you, this webinar would just be a small gathering of few people. Thank you very much. We've had participants from different countries, both within and outside the continent today. We are very happy to have you again, and thank you very much for attending the webinar again today. So members of GET Secretariat, thank you for putting this together. We're going to have another wonderful edition of the GET webinar by God's grace in March next month to discuss, where we will gather to discuss another very interesting topic in the area of One Health and biosecurity on the continent. Thank you very much, everybody that is part of this. I wish you a pleasant and wonderful rest of the day. And to our participants, thank you. We appreciate your efforts and thank you for joining us. Bye-bye from GET Secretariat. Bye.
Thank you.
Yeah.
Thank you, everybody. Bye-bye.
Thank you. Bye.